Hi, my name is Dr. Parky. I'm a clinical psychologist and behavioral sleep medicine specialist, and today I'm going to rate various different therapies or treatments or medications that people typically use for their insomnia and rate it out of 10 to let you know how I think about them and how good they are at actually dealing with insomnia, both in the short term and in the long term. So let's get into it. So number one is sleep hygiene. I often hear both patients as well as providers talking about providing sleep hygiene to deal with a person's insomnia issues. And if you don't know, sleep hygiene is related to factors that optimize our environment and our behaviors for sleep at night. So these include things like making sure that you're not like vigorously exercising before bed or taking caffeine or making sure that the blinds are closed and it's dark and quiet and cold in your room. And I think that while sleep hygiene is an important part of sleep health, it's not a very good treatment for insomnia disorder. It's not recommended by the American Academy of Sleep Medicine, and it's not effective in sort of the treatments and the randomized controlled trials. Sleep hygiene is sometimes even used as a control condition for actually effective treatments. So personally, I would rate sleep hygiene a 3 on 10. It's not a very good treatment, especially standalone for the treatment of chronic insomnia. It's a necessary component of sleep health, but it is not sufficient in and of itself to treat chronic insomnia. The next treatment that I'll talk about is melatonin. So melatonin is one of the most common over-the-counter supplements that people use for treatment of the insomnia. And again, just like sleep hygiene, melatonin isn't particularly efficacious for the treatment of insomnia disorder. It's a chronobiotic, so it can actually be quite helpful for more circadian rhythm disorders, like people who are night owls or who are super early birds. It can be quite helpful depending on the dose and the timing, but it's not a particularly helpful treatment for insomnia disorder. So in this context, I would also rate it a 3 on 10. And the reason why I don't rate it lower, like a 1 on 10, is because when I think about medication, I think about it both from a physiological perspective and a psychological perspective. So physiologically, I don't think melatonin taken, 10, 20 minutes before bed has a substantial impact on your sleep because endogenous melatonin is produced about 2 hours before bedtime. So you already have the melatonin produced, let's say at 10 p.m. when you go to bed at 12. So the melatonin taken at 11:30 isn't going to really give you an extra boost or really have any substantial effect. However, from a psychological perspective, your mind can say, well, I've taken my medication, I've taken my melatonin, so I should be able to sleep well. And it's that reduction in anxiety that otherwise would be there of like, oh, like I don't have my melatonin. What if I don't sleep tonight? You can see how those thoughts can make it harder for us to sleep. So for some people, taking that melatonin helps them to reduce the anxiety, which can of course foster some sleep, at least on certain nights. Okay, so number three are sleeping medications. So these are the sort of prescribed hypnotics like Ambien or Trazodone, the ones that actually show demonstrated efficacy in the research, as well as the ones that actually help people fall asleep and stay asleep, and it's not just the chronobiotic like melatonin. And I do want to first of all highlight that medication absolutely works. So medication, especially used in the short term, helps people to fall asleep and stay asleep. Responses may vary, like some people benefit more from certain classes of medications over others, but for the most part, it is actually an effective treatment of insomnia disorder, especially when taken consistently. So I personally would rate medication somewhere around a 6.5 to 7. So where I see medication fails and why I didn't give it, let's say, a 10 on 10 is because it loses its efficacy over the long term. So for some people, it might be that they notice that they're getting more tolerant to the medication, so they need to either up their dosage or change medication, or their kind of the effects start to reduce. And especially if they want to quit, their sleep problems usually return. And the reason why insomnia symptoms return following discontinuation of sleep medication is because sleep medication addresses insomnia at the symptom level. It doesn't address it at the cause level, where our sleep confidence, our ability to think that our body can produce sleep, and we understand sort of, let's say, the sleep habits are most likely to regulate sleep systems and help us support, better sleep, are not necessarily treated. So as a result, this is kind of like a band-aid on top of a wound. It's going to protect it for a little while, but at some point it's going to rot or, it's going to fall off and it's not going to be useful anymore. And one more reason why I don't really love sleeping medication is from the patient perspective. Like, patients don't want to be on sleeping medication. They don't like how it feels in terms of side effects. They wish they didn't have to be on it because they do, because they feel like otherwise they're not able to sleep. So from a tolerability perspective, like side effects, it's just not something that most people would like to be on if they didn't have to. So number four, I'll put into sort of like a general category of like relaxation exercises, guided meditation tapes, or use of ASMR, things that help for us to like feel and be in this more calm state. before we go to bed. So these types of de-arousal strategies using the tapes or the AMSR guides, like they can be reasonably helpful for some people. They notice that when they listen to it, they get into their zone and they're able to fall asleep really quickly. On the other hand, there are some people who listen to them, but they don't get the benefits, or it's kind of like very whack-a-mole, like it sometimes works, it sometimes doesn't, it's hard to really know. And I also see this as a bit of a tricky strategy because for some people, they start to think, if I don't have my tape, I'm not going to be able to fall asleep. If I don't do this, like there's no way I'll be able to fall asleep. And you can kind of see how this strategy, which, is helpful fundamentally, is actually in some ways obscuring a sleep anxious thought of like, if I don't have this, then I can't sleep. And that's not necessarily sort of the thinking pathways of what a good sleeper is. A good sleeper starts to develop a confidence that regardless of, necessarily where I am or whether I have my tape or not, I'm sure I'll be able to sleep well, or at the very least, be able to manage it and then get back into a place of nice sleepiness once I, let's say, return home from my trip. So my rating for these strategies, at least standalone, would be a 3 or 4 out of 10. And this is for certainly the treatment of insomnia disorder. Like it can be in terms of efficaciousness to help someone fall asleep, a 10 on 10. Like for some people who don't have insomnia, or it just so works well for them and they know they don't need it, but like they love having it and it feels good, then it can be like an amazing strategy. But for treatment of insomnia disorder, I would say I would put it on the lower end. And then strategy number 5 are these more kind of herbal remedies like, magnesium or chamomile or, let's say CBD or THC. I would say these strategies have more limited evidence in the literature, but they're in some ways promising that it does seem to have some impact on overall sleep quality, or, at least help someone kind of fall asleep a little bit faster. It's not as strong as some of the other evidence for gold standard treatments, but there's some moderate efficacy associated with it. And I would say, again, probably somewhere around a 4 on 10 in terms of my overall ratings. The biggest reason because I don't know if it's necessarily a solution that allows for long-term overall sleep health. And the reason I say that is because all of these different supplements like magnesium or the use of like THC or CBD, they are in some ways a bit of a crutch for the sake of being able to sleep. Like I take the supplement in order to fall asleep. I, use this, smoke marijuana in order to fall asleep. All those things, or alcohol, like all of those things can kind of be kind of impactful in both our, overall physical health benefits, like especially if you're drinking alcohol. But on the other hand, these other types of supplements don't really allow for high levels of sleep confidence. So the next strategy, number 6, is cognitive behavioral therapy for insomnia. So CBTI is the frontline recommended treatment for chronic insomnia, and it's certainly the one with the largest evidence base. It's equally efficacious compared to medication in the short term, but substantially more effective in the long run. So even after 10 years after treatment, you'll notice still that sort of significant improvement following successful completion of CBTI. And the reason why it's so durable as a treatment is because it addresses the underlying causes of insomnia, and it allows you to develop a certain level of sleep confidence that me and my sleep systems are capable of producing sleep irrespective of these other types of like medications or supplements or other things I'm sort of taking a crutch on. I'm able to produce sleep, not something else. So if I were to think about CBTI applied in its truest optimal sense by a seasoned clinician who knows what they're doing and can apply these strategies uniquely and personalized to the specific patient in front of them, it can be a truly life-changing and powerful strategy. So I personally would rate it a 9 or even a 10 out of 10 in terms of its overall efficacy for treating chronic insomnia. And where it typically loses points is because most people are not very well trained in providing CBTI. They provide it in this formulaic cookie cutter way to say, hey, like you sleep 6 hours, so I'm going to give you 6 hours in bed and, go ahead and do the thing. And unsurprisingly, the person does a painful thing and has a horrible experience, and it sucks for them. And now they think CBTI doesn't work for me. It sucks. My brain is broken, or something is fundamentally wrong with it. It's just, a terrible treatment. So I think that is where things get lost in translation, that CBTI is a very powerful strategy, but it needs to be personalized, and there has to be some level of human inclusion to make sure that the treatment actually works for the patient. So strategy number 7 are these more acceptance and commitment based, or ACT for insomnia, where we're essentially conceptualizing an insomnia as this resistance to wakefulness during the night and its impact on the day. So we are in some ways leaning into the wakefulness, being able to say, hey, like, I don't know what's going to happen tonight. I'm going to take a beginner's mind. I'm not sure. But if I do stay awake, that's okay. I can wait and trust that my body will eventually do what it needs to do and then give me the sleep that I need. And during the day, even if I am feeling tired, am I still able to engage as much as I can in these valued activities and not let the insomnia shrink my world? So acceptance and commitment therapies love their analogies. It's kind of like insomnia is like the playground bully. And, it's constantly telling you to do certain things or not do certain things. And your goal is to be able to say, like, I'm noticing that this insomnia bully is taking away from my life. It's making me just focus on the bad things in life. Can I still do all the things that I really want to do and not limit my life because this bully told me to do so, to make sure that I'm feeding myself and starving the insomnia bully? And I really love this sort of acceptance approach because I do think if fundamentally a person can go to bed, trust their body, and know that when it's ready to go to bed and sleep, it will do that for me, and be able to accept wakefulness for what it is, that a lot of the insomnia would unravel because it's our resistance, it's our desire to put effort into what is an effortless behavior known as sleep is what's kind of maintaining the insomnia. So being able to take this bit more of an acceptance perspective can be so helpful for treatment of insomnia. So I would actually also rate it at least kind of a 9 on 10 in terms of its overall efficacy. And certainly the biggest important thing is that CBT for insomnia and this sort of ACT perspective are not mutually exclusive. Like, they can be married in a way that really allows for both change and acceptance to occur to really get the most out of therapy. So hopefully you enjoyed this video. I know people usually like these kind of like rating and ranking lists, so hopefully you found it helpful as well as informative. If you enjoyed it, feel free to subscribe and continue watching because I'll be continuing to make videos about treatment of chronic insomnia down the road. Bye-bye.